Rheumatoid arthritis, or known as RA, is about more than joint pain. Even when you're not experiencing symptoms, you might be wondering when another flare-up will happen. If you're planning your day around flare-ups or suffering through even minor disruptions, your RA may be too loud. Rheumatoid arthritis is a chronic, progressive, and often debilitating inflammatory disease that causes pain, stiffness, swelling, fatigue, and loss of function in the joints. It can affect people of any age, but often begins between 30 to 50. About 300,000 Canadians live with rheumatoid arthritis, but many are undiagnosed. Now, remission is a goal for many with rheumatoid arthritis, as it means experience little or no disease activity, improving the quality of our lives. But how do we know to have this conversation with our healthcare providers? How do we know how to make the changes that we need? Our discussion today may help you identify your goals for your next conversation with your healthcare team. Topics that we are going over today are what remission means to us as patients and the lessons we have learned from our journey with the disease, what barriers we have faced in reaching remission, and tips on speaking to your healthcare team about reaching remission or what it means for you. We will also go over the talk over our discussion guide for a little inspiration for those wondering what to talk to with their team and evaluate the current treatment routine. My name is Lene Davidson. Many know me as Chronic Eileen. I'm from Vancouver, BC, Canada, and have been living with rheumatoid arthritis for the last 9 years of a diagnosis, but many years before that. I'm so excited to be a part of this discussion with so many other fellow advocates that are incredible and add their own unique perspective. Michael, take it away.
Thank you, Eileen. I'm Michael Kuluva. I live outside Toronto in Barrie, Ontario. I've had rheumatoid arthritis since I was about 28, so over a decade now. And it has been a crazy process. I'm so excited to be a part of Talk Over RA this season again. And I'm really excited to share what we found to try to help others. Julia, are you next?
Yes. Hi, everyone. My name is Julia McNally, and many of you know me as the RA Yogi and for Yoga for Arthritis. I'm from Montreal, Quebec, and I was diagnosed with juvenile idiopathic arthritis at the age of 2 years old, and then later on with rheumatoid arthritis, RA. If you want to know a little bit more about my journey, you can check out the tab on the talkoverra.com website. People like me. Lena?
Hi everyone, I'm Lene Andersen, and like everyone else, I'm really excited to participate in Talk Over RA this year. We have lots of fun things planned, fun and informative. You probably know me as the Seated View. Like Julia, I was diagnosed as a child. Which is a longer story because, you know, it was a long time ago. But it's 5 decades by now that I've lived with this condition. I grew up in what I call the dark ages of rheumatology when there was no treatment for RA. I use a mix of my lived experience and my professional expertise to advocate for the RA community. I'm also an author, writing books to help you live well with this condition. And I look forward to today's panel. Back to Eileen.
Thank you so much. So you see, I have a very dynamic team answering these questions with me today, and I hope that you all learn something new or just gets a little bit of inspiration. It's early in the morning here in the West Coast. All right, so I'm going to ask you all first what remission means to you as a patient. Now, for me, I'm going to go first, and that to me means little to no disease activity and leading a more normal life. I understand I'll still have pain when I have reached remission or close to it because I do have irreversible joint damage and also osteoarthritis along with rheumatoid arthritis. So to me, it would just mean leading the most normal life I can. And Julia, what does remission mean to you?
Remission means everything to me. More specifically, remission to me also means that my disease is under control. Like you discussed, the inflammatory markers are normal, that my joints are not swollen anymore, that I feel less to no pain, and that I can function on a day-to-day basis. that I have the energy to do the things that I love. And yeah. And what about you, Lene? What does being in remission mean to you?
Um, I've had uncontrolled RA for most of my life and finally found a medication that works about 18 years ago, and it's still working in the sense that it brought me into remission. And this might sound a little flaky, but every day it feels like a miracle. There's really nothing, no other words I can find to describe it. I feel lighter, stronger, less fragile. My mental health is better, and it enables me to do everything in my life, to live it joyfully and fully. So like Eileen, I still have fatigue and chronic pain from RA damage. So, it's not blissful every day, but I'm still grateful every day for having my RA controlled. Michael, over to you.
Thank you, Lene. Yeah, I've been thinking about this for a while, and you guys made up some great points. I think that I'm on the same page with almost everything that you guys have said. I believe that day to day, remission is amazing, and that's what I'm trying to strive for. I'm striving for not as much pain. I know I will be in pain, as you all said, but to a degree where it's tolerable. I'm able to get out of bed and still live my day-to-day life, like Julia said, and to have those markers really come to an agreement of what the doctor and I really expect, of course, with, our treatments. I really want to get back to my day-to-day, as always, with remission, with walking my dog and trying to do whatever I would like to do and not have to think about my body first and then think about the plan of what I'd like to do for the day. So when you're in remission, it really does bring a sigh of relief and also mental stability, like Lena said.
Okay, next up, let's go. Let's talk about some of the barriers we've faced in achieving remission, and I'll go first, and then the others will share theirs. For me, the biggest barrier was the time I was diagnosed. There was very few treatments for RA at the time, and they didn't really work. And of course, money is also an issue. In 2005, when I was prescribed a medication that eventually brought me into remission, I had to wait 8 months for approval from the provincial medication funding program because I couldn't afford it on my own. And thankfully, I've been told that process no longer takes quite as long, but the expense of the treatment we take can still be a major barrier. Michael, what are some of the barriers you have
I've
experienced?
experienced quite a few. Being new to Canada, it was hard navigating the healthcare system on me trying to find a rheumatologist. And then once getting the rheumatologist, trying to get on the right treatment plan. It was years in the making and it was difficult. Now that I am on the right treatment, I do see a path forward to remission, but there's a lot of obstacles just finding the right person that will listen to, the right doctor, the right receptionist. There's all these people in the community that really do play a big role in leading yourself to remission and to finding the right combination. What about you, Julia?
Thank you. I completely agree with you. And I've also had some barriers in that regard. Like Lena, I was diagnosed very young, so the treatments just weren't there for us, unfortunately. The treatments that were available, I've experienced many different side effects, allergic reactions, and difficulty with efficacy as well with some of the treatments. There was not a lot of support resources and education about arthritis awareness, rheumatoid arthritis awareness, and how to deal with that in a school setting and how to deal with that in a workplace setting, which is getting better, but it still needs work, as we all know. Other health issues have come up, unfortunately, due to having an autoimmune disease in the first place from a young age. So I've been diagnosed recently with EOE. It's an esophagus autoimmune disease. So white blood cells collect around the esophagus and make it hard to swallow food, solid food and liquid, which is a very fun thing to experience. I'm being sarcastic. But luckily there are specialists there too, but that just adds on to the amount of time that I'm in medical appointments and trying to find new treatments for that. That is very separate from my RA. So I would say that the barriers that I've experienced are in the health related sector, but also with work as well. Just as, we've all experienced ups and downs with this disease. Sometimes it's difficult to stay at work full time. We need accommodations in the workplace. We need to work for ourselves at times. So these are the barriers that I've experienced so far with this disease. And I'd like to know, Eileen, what have been your barriers?
I've experienced quite a few similar barriers. The time of diagnosis, it took years for somebody to even take my pain serious. I was told it was chronic pain by carpal tunnel syndrome for a long time, and it actually ended up taking me to investigate everything that I was feeling and ask for the rheumatoid arthritis blood test. And even still then, the family physician at that time was just dismissive. You don't have swelling, you're a bit young for it. And so I think the first barrier I ever experienced was not knowing what the symptoms were when I should have, because 1 in 4 women develop a form of arthritis. So I think that's very important to know as soon as possible. And then I also think that healthcare professionals outside of rheumatologists need more education on our disease so that they can help us catch it early on, especially since, research shows that women who have a child are often showing signs after pregnancy, which is sort of what happened to me. I had signs before, but it wasn't until after I had my son did it. I clearly tell something was wrong. I was losing lots of different kinds of function. And then it took me a long time to find that right treatment, mostly because of insurance reasons and how the Canadian government has our medications outlined. And that's really unfortunate because research shows that those who receive effective treatment early on have the best outcomes. Then, of course, I have multiple comorbidities from before RA. I was diagnosed with depression at 17, and I have fibromyalgia, and I have osteoarthritis, and that's all the things that impact the ability to reach remission where I have no disease activity. So I'm probably looking more at low disease activity versus no disease activity. And I'm also seropositive over seronegative. And there's conflicting research out there that says that seropositive is trickier to treat and may not achieve remission, but I've also read other things. I've also received trauma in my life, and trauma has thrown me out of almost remission. And then also there is the fact that people without a support network tend to do worse off. So I'm single, I have a child to look after, I don't have family around, so I have very little support locally or around me. So that does impact my ability to have a better outcome. Now, Julia, you're gonna ask us our next question.
Thank you so much, Eileen. We wanted to talk about what we want other patients to know about RA and remission. And I wanted to discuss how RA is a very challenging disease, but it's not impossible to improve one's health. And I like to look at myself as a whole person when I think about, disease management. It's not just about my RA. It's coming from a whole person approach. How can I improve my physical health, mental health, emotional health, my social health, environment? How can I look at these aspects of wellness and take action? So I like to look at it that way. And also, what do I need help with? So I like to be able to share this with other patients, that there's a lot that we can do ourselves, and it's okay also to ask for help and to get the specific support that we need. everyone's care and treatment looks different. And if it's not working for you, then it's definitely a time to talk over RA, which we're going to be discussing later on very soon, as well as providing some guides and talking about it ourselves. Eileen, what do you want other patients to know about RA and remission?
I thought long and hard about this one, and I really love your answer. So I'm going to build off something a little bit different, but it is every patient is different. What works for one isn't going to work for another one. Maybe you kind of have to go through a lot of trial and error to find what works for you. And it's different per everyone. I call that the arthritic rule of thumb. Lena?
Yeah, I think we all agree on a lot of these things, and I think I love how Julia talked about being a whole person, because RA takes up a lot of room. It can be really, like, it sort of takes over your life, and then it's all RA all the time, and you kind of forget then why you're doing this, why you are fighting for remission. And so I think it's important to make sure that you focus on finding a way to include as much life in your life as possible. And to that end, one of the things that makes that easy is that whole push to get the treatment you need. And I want you to know how important it is to treat your RA early and aggressively. Like I know firsthand the impact that RA can have on your body and your life. And I had an interesting conversation with my rheumatologist a few years ago that talked about the impact of effective treatments. She has hundreds of patients, like any rheumatology, and many of them, a really big percentage of them in the past would use mobility aids such as wheelchairs and crutches and scooters, etc. Now, out of those hundreds of patients, there are only 2 wheelchair users, and I'm one of them. And that speaks to how important it is to protect your body by pursuing treatment that gets you as close to remission as possible. And sometimes your quote unquote miracle treatment isn't out there yet, but getting as close as you can matters as well. And it can be really scary to get a diagnosis of RA, and it can be really scary to face having to take medication. So make sure you talk to your rheumatologist, ask questions, understand the pros and cons of medication, but also understand what happens when you don't treat your RA. It's about informed consent, and that means pros and cons of everything, right? And just to kind of remember that remission is about getting back to living your life. Over to you, Michael.
Thanks, Lena. Yeah, I'm gonna just touch a little bit on all of what you guys said. I think that's all very true. I really feel that patients really need to believe that I have to stay positive. I think there's a lot of negativity in this disease, and when you read about it online, I think there's groups like us and others that are really great for resources and that come together to speak about it like how we are, and that to know that you're not alone in the fight, that there are other people like us all around every day that you might not even know that have it, and they might not want to talk about it, but it is really important to know that you're not alone in the fight. Everybody's here for you, even if they're not locally with you. We can be on social media and in other ways together as a community. And I really like that there are those options. When I was first diagnosed, there weren't a lot of options for this. And I'm so excited that there are now, because for our mental state and for the longevity of this disease, to have the support of everybody, including the community, is vital.
Michael, you have a question now for us.
What advice do we have about talking to your rheumatologist about your rheumatoid arthritis? I will go first. I would always say write down all your questions, number one. I always forget when I get into the doctor's office almost everything I want to ask him until I leave. And then I'm like, oh no, I have to go back or call or try to get the secretary involved. And that's just never a good sign. So I really recommend having your iPhone or iPad or a piece of paper and just start getting your notes down of what you want to ask, any questions, any things that are concerning about your body. If you feel that something's off on your body, ask about it. There's no stupid questions. So I really believe that any question will get an answer. And if you don't get that specific answer, keep pushing and trying to find it because you will. And just don't ever let the doctor say no to you in a sense when you can always find a yes around it or possibly another alternative. So I always say, keep all your questions together and always try to communicate the best you can with your rheumatologist about your disease, everything you're feeling, and they will be able to help, hopefully. Okay, next person I'm going to pass this on to is Lena.
I agree with Michael about how important it is to write everything down, because rheumatologists are really busy people. So there's sort of a pressure the minute you get in there to get everything done right now. They have their own agenda, what they need to go through. And if you don't take initiative, it's easy for that to be the only conversation that happens. So I think it's important to shift your perspective to that of teamwork. You and your rheumatologist work together to improve your quality of life. Your rheumatologist is a highly knowledgeable expert, but you are the leader of that team because this is your life and your body. So you're the person who makes the decisions based on their recommendations and how it makes sense for your life. I prepare for every appointment like I would for any other meeting. And I often use the Talk Over RA discussion guide that we'll show you towards the end of the session. I think about my goals, my questions, my symptoms, and I write it all down. And I also try to make the symptoms real in terms of what is the impact it has on my life. For instance, is my fatigue preventing me from working? Is my pain lasting longer? Like, it's making me cry in the shower. That's one of the really kind of effective ways of saying I hurt so much in the morning that I cry in the shower. So you make it real, you show the impact on your life. And then once I've written that down, usually on my computer, I print out 2 copies, one for me, one for my doctor. And it helps to create a sort of agenda for the appointment, and that helps my issues and my questions be part of what happens in that appointment. Eileen?
100% agree with every single word both of you have said. Writing things down, super important. The Talk Over RA guide has actually helped me during some of my appointments, and I've actually had treatment changes and things like that. So it's been very helpful me. Excited to go over that later. But, there's no silly question. I think it's really important for us to remember to bring everything up when it comes to rheumatoid arthritis, because this disease is so much more than just joint pain. If your fatigue is high, if you're having cognitive dysfunction, if you're having skin issues, if you're having tummy issues, whether they're super embarrassing or intimate, you should still bring them up, including intimacy. Our drugs can affect how our orgasms are going and things like that. So these are very, very important things to bring up to the rheumatologist. And I've learned over time now to bring up all of them to her, because whether she can treat it or not, she can send me to somebody who can investigate further and treat it, and also recommend somebody who has a knowledge of rheumatoid arthritis versus just anyone. Because from my experience, when I just get randomly paired with somebody, they might not understand my condition enough or my medications enough, and things can go a little south. So I think it's really important to feel there is nothing you can't tell your rheumatologist. And if they say they don't know, that's okay. They're human too. That's not their specialty, but ask them if they can refer you to somebody who would know. Julia?
Thank you, Eileen. I think you all have such a wealth of knowledge on this topic, like myself as well. And I just want to go through the points that I felt really I connected to from all of you and then share mine. So first of all, Michael, my iPhone is with me all the time during appointments. I literally have a health log from every appointment. So thank you for bringing that up. No stupid questions has been echoed from all of us. That's so important to remember. And Lena, talking about the specific effects that symptoms have on your life, that really makes a big impact on speaking with our rheumatologist. So thank you for bringing that up. And Eileen, coming to your doctor with as an open book, talking about intimacy issues is so important. Talking about any other issues we might be experiencing, whether they're physical or mental health issues, you know, it's all important. And I wanted to bring up advocating for ourselves. When we need new treatment, when we need test run, and sometimes we get pushback from our physicians. Maybe they don't have the time or the resources. I was just speaking with a doctor this morning, and she said, good on you for saying that maybe right now isn't what you need is to be on medication at this moment, because I was on medication since I was 2 years old. I needed a break. You know, it's okay to know your body, and it's not because I'm not compliant to treatment. I'm on my 4th biologic. But I think it's really important to share that with all of you and with the people that are watching this, is that it's okay to advocate for yourself and your own health.
Next up, we're talking about the biggest lesson we have learned about remission and our RA. And I've learned that it may take a while to find a treatment that helps you go into remission. For me, it took me most of my life, but that was other factors. But I've also, like Julia, been on medications if I couldn't tolerate the effective dose due to side effects. But it's about not giving up hope. The journey can be difficult, but finding a way to keep hoping and is an essential part of keeping you going. Like, lean on your family, your friend, your medical team. Let them know when things are hard, so they may find other ways to support you while you together look for, you know, they pursue this quest of achieving remission. I learned how important it is to keep pushing forward. Yes, to Julia's point, sometimes you need a bit of a break, because there are no vacations from chronic illness, unfortunately. But we all need every now and again just to say, okay, I just need to bring myself back and center myself, and then take the next step. Remember that you're fighting for your ability to live your life in the best way possible. So never give up. Like I said, I had active RA for, I don't know, about 4 decades or something like that. And it took that long to find something that worked for me, partly because there wasn't anything available. But you never know if your miracle is going to be out there, you know? So keep pushing and keep hoping. And next up is Julia.
Thank you, Lena. So my personal story with remission has been a journey, and it's been a really long time since I've been in remission for long periods of time. Maybe I'll be in remission for a few months, and then I'll have an RA flare-up for years. And RA flare-ups can be, you know, a few days, a few weeks, a few months, or many years, as I've been experiencing. But I think it's important that this campaign actually helped me to get back to the treatment that I needed to be on. I was afraid of being on the next level of treatment, and it really helped motivate me. I'm not where I want to be just yet, but I'm really proud of how far I've come, and I'm still fighting. And I think it's important that when you are in remission to really appreciate it. It doesn't mean that the disease is gone. It just means that we need to continue to manage our disease. and it's worth fighting for remission. We have to keep an open mind and try different things, and remember it's never too late to begin again. Even when your life feels upside down or uncertain because of RA, it's definitely worth the fight. So I would love to know what Michael thinks about his own personal journey with remission and this disease. What are the biggest lessons you've learned?
Thank you, Julia. Yours is very well said. Thank you. Yes, my remission process has been a process in that it's still ongoing. It will be ever ongoing for the rest of my life. I think that the biggest challenge is actually just figuring out what that means. And it can be a day-to-day thing where you know that you're in remission for a couple months, as you said, Julia, a couple years, possibly if you're really lucky, or you can go into a flare-up, which will last the same amount of time or longer. I really do believe that understanding that concept helps you understand this disease a little bit more and really understand that flare-ups are going to be there inevitably for as long as you will have this disease and until we have a cure for it. So just to really take it day by day, don't get down on yourself. This stuff happens to all of us and everybody's different, as we said before. So some people, their flare-ups are different than others and more extreme, and it can really be debilitating. And it can go on for years, and some people have it for a few weeks, for months. Mine has been up and down, just like Julia and Lena's, I'm sure Eileen's too, that it really does differ on every year, every other day. You just don't know. Some days are better than others, and then other ones really you do struggle. So really just understand that as a whole, and that you're not alone on that, and that it really will get better over time. Things do always get better, even though it might not seem it at the time. Just try to stay positive. Eileen?
I think that my biggest lesson in regards to being close to remission, I actually have not achieved full remission yet. Partially because I do have moderate to severe rheumatoid arthritis. That's a huge lesson right there. And also, I'm seropositive, so that may also indicate why, and plus my comorbidities. But my biggest lesson when I was really close to remission is that certain things like trauma and stress can bring it out, and how important it is to take care of yourself to avoid things like that. Because it's been a couple of years now since I've had a fairly traumatic event that pulled me right out of remission. I fell down some stairs and broke my butt. And so I haven't been able to get back to where I was from there, because the process is long. You know, that made my medication stop working. So there is then again having to start over, trying to find a medication that works for me, and also learning to do the self-care that I once was doing with progressed rheumatoid arthritis. So it's a constant learning curve, and trauma is one that I think was a huge lesson that can interfere with our health, because it affects not just our body, but also our emotional state. And when both of those are hurting, it's very hard to take care of ourselves sometimes, and focus on everything that we need to do to get as healthy as we can. Next, we are going to go over the Talk Over RA guide. Our purpose with this one is we're going to talk about what we filled out. So hoping to give you an idea of how to talk to your rheumatologist and your other healthcare team about your rheumatoid arthritis. I know when I was first diagnosed, I had no idea what to ask my rheumatologist. I was terrified. She's a Harvard graduate, and I'm just like, I don't even know what rheumatoid arthritis really is. So it's very important to listen to patients along the way. I think listening to patients' stories and what they're talking about has helped me become more confident in my disease and able to ask questions that are super important. So our first question is going to start off with Julia.
So here on the talking points for your next appointment, it's on the Talk Over RA website. It says, be specific about your goals. Start by thinking about the ways that RA impacts your life and the specific day-to-day challenges that you face. What do you most want to be able to do? For example, are you a kindergarten teacher who wants to be able to sit on the floor with her students? Are you a parent who wants to feel well enough to go to your child's sporting event? Do you want to be able to run errands and carry groceries on your own? What I most want to accomplish in the coming weeks and months. The ability to find an accessible job and the energy to work full time for a long time. And a more fun one, I want to play tennis again. I am a huge tennis player and I haven't been able to play in so many years. And that is my dream, to be able to play for an hour with breaks. That would be fine. To not get infections every month. That is something I'm going to be talking about with my rheumatologist at our next appointment, because being on my treatments, I'm open to infections, even though it helps me with my disease management. So that's a goal, to not get infections every month, to be able to take a 30-minute walk outside and not have to nap after or lie down for the rest of the day. These are my goals. How about you, Michael?
Yes, I have some of the same goals, maybe not as extreme, but yeah, mine, I still want to exercise daily, which is a main thing that I like to speak to my rheumatologist about if I'm not able to do it. It really shows that there is something wrong with me at that point if I'm not able to do my 30 minutes a day walking. I have a treadmill because where I live, it gets quite snowy and I can't get outside all the time. So I've invested in that so that I can keep my body moving even through the winter. But yes, I like to talk to my rheumatologist about also my hands. I use my hands a lot for typing, for sewing, for cutting fabrics, for almost everything, right? So for me, my main thing is always trying to see how I can reduce the inflammation in my hands, what I can do at night to, relieve some of the pain. And if there's anything with my diet that I can change to try to help with what I'm doing, as sometimes I get lazy if I'm tired or fatigued and I don't make the best meal choices. So I really try to think ahead and meal prep as much as I can, or have things available in the refrigerator that I know will be easy for me to either heat up or make sure that it doesn't go against my treatment plan that I'm working with or working for. I always talk about my rheumatologist too with, what's coming up in my life. I think Eileen spoke about this a little bit with stress as a trigger. That's huge for me. So if I know that there's something big coming up or there's something that's going to be really impactful to my daily life, I will let my rheumatologist know, and we can try to navigate that with a treatment or with some suggestions on how to minimize the flare or the stress. What about if we give it off to Lena now?
So I have a very short answer, but it's also a long answer. As ever with RA, it's always complicated. I want to have my health stable enough and my fatigue under enough control that I can write my next book. And thank you. The main barrier in this is fatigue. I've had fatigue for quite a long time, deeper fatigue than normal, and I'm done with it. I am very tired of being tired. But I also am running up against an issue due to some policy changes. I have to change my treatment, and finding something that works as well as the one I've been on for 18 years is with the same or less side effects is turning out to be a little bit of an adventure. So I want to talk about that. And I think next up is Eileen.
I'm gonna have to say I agree with all of you. I think that you've all touched base on how the symptoms of rheumatoid arthritis affect our daily lives. And there's things that we want to tackle with our symptoms to be able to do. And I love that. Instead of looking like I want less pain, I love looking at goals that we want to do. For me, I just want to be exercising every day, and I want to be able to have no flares in my feet by early afternoon. I want to have less naps, even though I love them, especially I have cats to nap with. I just want to be more productive and feel better about my productivity every day, and not have those symptoms be so loud.
So number 2 on the talk over RA list that we have is evaluate your current well-being. Always remember to tell your rheumatologist how you're feeling. It's okay to say if you're not doing well, but it's just as important to let them know if you are doing well or better than before. You also want to let them know how you're feeling exactly today in this moment, how you're sitting right now in that chair in their office, on their table. What are you feeling right then? And how do you describe this to your rheumatologist? For me, I literally have to show him my joints, and then I also explain to him that it feels like a stabbing pain to me. It feels like knives going into my joints. I don't know how to explain it to other people exactly. Sometimes because unless you have the disease, it's really hard to explain all of the pain and all of the discomfort that you get and exactly how you're feeling always with words. But a lot of rheumatologists are very, very caring, and they also listen very well, which I really enjoy. And I really believe that if you find the right rheumatologist who listens, they will understand you, they will understand where you're coming from, and they will create a treatment to try to help you. Let me pass this over to Lena.
Who has to unclick my mute button first? Well, as I said, I am trying a new medication, and although my RA is so far still under control, it's severely increasing symptoms from one of my comorbidities, and this particular section has little emoji faces to indicate how you're feeling, and I'm all the way to a sad face on that. How about you, Eileen? How are you doing?
I think about this when it's like my current well-being isn't a necessarily true reflection of how I am doing with my rheumatoid arthritis, because it fluctuates so much. So I always, before I answer any questions like this, what have I been doing lately? So I just got off an airplane a few days ago from a conference, so I'm probably kind of right in the middle near the sad face, but that's because I've overdone it. I'm going to look at how I felt over the last month or so and go back to tracking my health. How have I felt that whole period? Because if I've overdone it, I'm going to have symptoms. But if I'm not overdoing it, I'm taking lots of care of myself and I'm having symptoms, that's something I need to bring up to my rheumatologist, because that means it's something that's a bigger problem than just overdoing it. How about you, Julia?
Well, I'm sorry to hear, Lena, that you have a sad face today. And Eileen as well, that you're in the middle. I actually put myself in between sad and a straight face. You can't see it actually with the background, but that's okay. It looks like that. Okay. So I tried to stop taking steroids, but after tapering down and stopping taking them for 3 days, I right away had trouble walking and experienced severe pain. I just got on a new biologic not too long ago, and I've only had 2 doses. So I feel like I need the steroids to help me keep my pain at bay. So right now I'm in this weird kind of limbo where I really need to speak to my rheumatologist and tell them about my current well-being. It's not where I want it to be. So that's the next step, and this guide is going to help me. So
yeah, that's really important. That goes straight into kind of our next question, because our next question is evaluate your current treatment regimen. evaluate how you're feeling with your current treatment regimen. It's important to share if your medication is helping you, as it is to share your concerns. I kind of put myself in between happy and the straight face, because the last time I spoke to my rheumatologist, which was recently, I actually used the RA talk over points, and we ended up adding another treatment to my treatment because my blood work was high, I wasn't feeling good enough. And so for the fact that my rheumatologist was willing to help me and listen to this, and because I know that my treatment's going to take 3 to 4 so months before I really feel something, I'm pretty happy that I have a supportive rheumatologist that is, working with me to find the right medication regimen for me. So I'm curious, Michael, where are you at with your treatment regimen?
I just saw my rheumatologist this past week, so I'm pretty on top of my appointments right now. We just went over it actually when we actually added something into it. So I am building upon what I'm doing right now. It was a while since I've seen him in person. We did a lot of virtual consults because of the pandemic, so it was really nice to see him in person again. And I think it really does help to see your physician if you can in person. It just really gives a different feeling to showing your symptoms and even just discussing things a little bit further. But yes, I added something into my routine right now, so I'm just kind of in limbo as well. I'm kind of with like this kind of phase 2. I'm a little bit more happy, but not as happy as I should be because I'm just starting it. There are some side effects that I'm sure will hopefully linger off, but I'm just kind of in limbo right now, trying to figure it out as well. I'm going to pass it over to Lena.
Thank you. Well, I'm conflicted. Like I said, there's never a straightforward answer with RA. It's always complicated. So in terms of me rating myself on my current treatment regimen, well, the new medication I'm trying seems to be doing well for my RA. So, knock wood. I always knock wood when I say that, just in case. But the side effects is mitigating that. So I'm sort of in the middle with the straight face. I'm RA wise, I'm happy. The rest of my body is unhappy. So I'm sort of averaging that out.
So evaluate your current treatment plan for me is a straight face, because I'm still giving time to my medication that's pretty new to start working. I have a flu and I'm worried about infections, like I mentioned before. So do I need another type of medication to help me through this? That's something that I'm going to have to be discussing with my rheumatologist next, which is on my guide.
Next up, we talk about questions and comments. The form says it's important to be open about your treatment regimen, even if you find it difficult to discuss your concerns. For instance, if you experience side effects or you're having a hard time sticking to the dose or the schedule, it's important for your doctor to know. And for me, this new medication is making me increase time between doses. And it's affecting what's been proven to work for the last 18 years. And I expect that eventually this will push me out of remission. So I want to really emphasize that in my next appointment.
I think the most important question that I've asked lately is my current treatment enough? Michael?
Yes, like I just said, I think the question before is that I am changing up treatment plans right now. So I'm just a lot of questions of how is this going to work? Is this going to work? And for how long is it going to work? So, yeah.
So number 4 of the talking points for your next appointment is documenting your symptoms. So for myself, I wrote down that I couldn't walk, but steroids helped me to get up and about again. But I felt terrible brain fog, anxious, mood swings, and teeth grinding at night. And I put that I've been able to walk more, so that's and more frequently. But now that I'm getting off of the steroids, I'm having pain again and difficulty walking. I feel tired all the time. I have pain in my knees, spine, and my right hand and wrist while I'm walking, sitting, and using my right hand. What about you, Lena? What did you write in your documenting your symptoms?
I wrote that this new medication is having a severe impact on my comorbidity. It affects my appetite, my fatigue, my brain fog, how well I sleep, and my overall well-being. And it's not just, a few days after my meds, which I could kind of deal with, but it's every day for every day in between the doses. And before I started the new medication, I was essentially my normal self, what's normal to me, and this has started since I began taking the new meds. What about you, Michael?
For me, it was just having a lot of fatigue and then also having inflammation that wasn't going away. So I needed to change my treatment plan a little bit. It's just been a process, and I think that the inflammation in my hands have been really the ones that I've been going back and forth with. It happens almost every day and it stays for almost the whole day. So it's something that I've just been really trying to tackle. What about you, Eileen?
Yeah, so it's funny because when I went to my rheumatologist last time, I wasn't experiencing symptoms that I thought were stereotypical RA. It was more so but my blood work that told me what I was going through. My CRP was really high, but I wasn't experiencing the pain in joints that I normally feel that when I have really high CRP. So, but what I was experiencing was fiery feet, as I call it, in the middle of the day. It wasn't at the end of the day after I'd been on my feet too long. It was earlier, and it was almost daily. And I was having naps, usually around midday. I was needing those. And the only thing that would help me feel better was like a good 2 to 4 hour nap. And so I was feeling sluggish and everything. And yeah, my blood test showed me that I was in a flare, even though I thought I was just doing too much or was wearing the wrong shoes or something. And I expected it to be more so in my hands and other joints, but it wasn't. So I think documenting our symptoms and kind of watching them and knowing that it's not going to be always stereotypical RA symptoms.
And that brings us to always asking questions to your rheumatologist. If there's something else you don't understand, or if there's something with information that you need, don't be shy to be asking about it. You're well in there to ask any question that you have. Write down your questions, as I said before, so you don't forget. My questions that I always have for my rheumatologist is usually the first one is, what is my blood work say? Just like Eileen said, like you can tell a lot from your blood work that you do usually before you go in to see a rheumatologist. I always ask about where my levels are at, where I can do better. And also I always say, about my diet. How is my weight? How is my my vitals doing as well? I always like to keep on top of that because it really does play a big impact on my day to day. How about Lena? What about you?
I think my questions would be, what are the steps involved for the next step? Can I go back to my old medication? Do I need to try something else? And most importantly, what can I do to help? Julia, what about you?
Thank you, Lena. Can we go over my latest blood work together? Is something I always start with my rheumatologist. Am I well enough? Like, am I stable enough to be at work, or am I exacerbating my situation? Should I be on prophylactic antibiotics to treat infection, which means like intermittent antibiotics instead of treating the infections as they come, being on a biologic? can I stay on my steroids longer is a question that I ask a lot. And what's the dosage for how long? Yeah, just connecting my other specialists. This is a really important one, is I ask my rheumatologist, can you look at the medical notes that my other specialist wrote if it pertains to something with my RA as well? For example, like I went to infectious diseases, I was dealing with multiple infections, and I had to get off of my last biologic, and the specialist at infectious diseases said, you should not be on regular antibiotics. So just treat things as they go, but I should be having them speak to each other. So that's a question that I would bring up to my rheumatologist. What about you, Eileen?
I agree 100% with everything you've all said. I always say, do I need any tests? This might be anything other than blood work too. Blood work's super important, but also ask, are there things that we should be testing in my blood work, like my vitamin levels, and if I have any deficiencies and things like that? That can actually contribute a lot to how we are feeling. And sometimes our medications can make us deficient in certain minerals, vitamins, and all that. And then also asking if I need to see any other specialists is really important. This could be somebody with mental health, my physical activity, just figuring out how to do everyday life, like an occupational therapist, to seeing an endocrinologist, to a lung specialist, because rheumatoid arthritis is a systemic autoimmune disease. It's going to affect so much more than just our joints, and it really does take a healthcare team to treat it. So I always ask, are there any else I need? And on that note, we are done our talk today. We hope you have learned some valuable information. You have come up with some questions to ask your specialists, or even just feel a little bit more knowledgeable about your condition. Rheumatoid arthritis is not an easy disease to treat, but remission or low disease activity is possible. And it's something that you need to speak with your rheumatologist and the rest of your healthcare team about. So thank you so much for coming today and watching us talk. Any last words from you all before we close off?
Yes, just briefly, treat yourself with compassion. Always advocate for yourself, and please use these tools that are available for you on the Talk Over RA website.
For me, that covers it. Be nice to yourself.
And I always say, stay positive and make sure to stay within our community and ask questions. Follow us on social media and also on the Talk Over RA website.
My last piece of advice for everyone is listen to patient stories. You can learn so much more as you learn from a doctor. Thank you so much.